Welcome to our class. Welcome to the language clinic. Welcome to the language clinic channel. I think hypertension. Now we are going to talk on hypertension. Hypertension is a very common disease not only in Bangladesh but also all over the world. So I think we should have some knowledge on hypertension. And the writer is Gabriel B. Habib SR. His degrees are MD, FACC, FCCP, and FAAC. He is Professor of Medicine, Department of Medicine, Baylor College of Medicine, Houston, Texas, USA or United States of America. United States of America. Let's talk about on hypertension. We will talk about 26 questions on hypertension and the answers to those 26 questions. Question number 1. What is the prevalence of hypertension in men and women and across various ethnic and racial groups? Hypertension affects over 100 million United States adults and more than 1.13 billion adults worldwide. Hypertension is the leading cause of death and disability worldwide and is the most important global risk factors for cardiovascular risks, coronary artery disease and stroke. A greater percentage of men, namely 47%, has high blood pressure or BP than women, 43%. The prevalence of hypertension is higher among younger, less than 60 years of men than among younger women. However, starting at 60 years of age, the prevalence of hypertension in women catches up with and eventually exceeds that in men. About 85% of women and only 79% of men 75-year-old or older are hypertensive. Overall, hypertension is directly related to mortality in a greater number of women than men. High BP or high blood pressure is more common in African Americans, namely for 54%, than in non-Hispanic white adults, 46%, or Hispanic adults, 36%. Blood pressure control is higher among non-Hispanic white adults, 32%, than among African Americans, 25%, or Hispanic adults, 25%. Question 2. What are the stages of hypertension? Hypertension has been classified in the 2017 American Heart Association or American College of Cardiology. American Heart Association is simply called AHA and American College of Cardiology is simply called, briefly called ACC. Hypertension guidelines as follows. Normal systolic BP less than 120 mmHg and diastolic BP less than 80 mmHg. Elevated BP, systolic BP 120 to 129 mmHg and diastolic BP less than 80 mmHg. Hypertensive stage 1, systolic BP 130 to 139 mmHg or diastolic BP 80 to 89 mmHg. Hypertension stage 2, systolic blood pressure greater than or equivalent to 140 mmHg or diastolic BP greater than or equal to 90 mmHg. The new definition of hypertension recommended by the 2017 American Heart Association or American College of Cardiology hypertension guidelines is a BP of 130 by 80 mmHg or greater. Based on this new definition of hypertension, the prevalence of hypertension among US adults more than 20 years is 46% overall, and as high as 50% and 44% among men and women 45 to 54 years of age respectively. Question 3. What are the 4 primary complications of hypertension? The 4 most important complications of hypertension are coronary artery disease and myocardial infarction, or in short it is called MI. Heart failure with preserved ejection fraction or heart failure with reduced ejection fraction or heart failure with reduced left ventricular ejection fraction, chronic kidney disease or CKD, and renal failure, and last is stroke. Question 4. What are the goals of hypertension management treatment? Reducing elevated BP levels or blood pressure levels is an important strategy to prevent various complications of systemic hypertension, including stroke, heart attacks, heart failure, and renal diseases. The best predictor of the efficacy in preventing various cardiorenal complications is the degree of reduction of BP.
আপনার পরামর্শ দিই।